This is Pet Life Radio. Let's talk pets.
This episode of Vet Candy is brought to you by Vet Naturals, makers of hemp hips, developed by vets, approved by pets. Learn more at vetnaturals.com.
Welcome to another episode of Vet Candy's podcast. In other news, this is a podcast to expand your idea of what's impacting veterinarians, veterinary technicians, and all animal health professionals as humans. I'm your co-host, Dr. Jen.
And I'm Dr. Jason Chatfield.
If you're not yet a Vet Candy subscriber,
why not?
Please subscribe for free today at myvetcandy.com. And for all messages of love and positivity, you may reach me at jen@myvetcandy.com.
Or Jason at myvetcandy.com for all of you serious-minded folks. Bring it to the real.
Okay, so today, I'm pretty excited. Are you excited?
I'm always excited.
Well,
this is my excited face.
You've got your excited face on?
I have my excited face on, yep.
So our topic today, you ready? It's one of our favorites. We love to talk about this. Puff, puff, pass. Our topic today is CBD and all associated compounds.
Yeah, there's a lot of those. So in other news, is CBD effective in pets? That's a question that's out there, I think.
Oh, it's really a question that's out there. And I'm really excited because into the Candyverse, we're bringing an incredible guest.
Yeah, always. We always have to have an incredible guest to make up for you. I mean, to make up for me. Yes, I get it. Yes.
For the host.
Yes,
for the host.
Right.
Yeah. Well, what's interesting about this guest is that, man, he's all over the place right now. Have you noticed?
Yes, everywhere.
The dude's an expert in like all kinds of stuff.
Almost everything.
I know, surgery, COVID-19, like management, communication, and CBD.
And CBD. Blah, 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 and CBD. That's 100% right.
Oh, yeah, exactly. And what's even better, well, it's not so great for the news hounds in the Candyverse, but so this is a Sunday.
This is Sunday.
We're recording on a Sunday.
Yeah.
That's because our guest is so popular.
Yeah, I was wondering, why are we recording on a Sunday?
Yeah, it's because to get this guy, we had to do it on a Sunday.
Makes sense now. I was wondering what was happening. I'm game for whatever, right? I'm not that busy, right? I'm not an expert at anything, as we all know.
That's right.
Ain't no one breaking down my door for my opinion.
No, me either.
All right, so Sunday's fine with me, but why Sunday? But now it makes more sense.
It makes a lot of sense. Right. And sorry, news hounds, that this is not one of our video podcast episodes because this dude has a face for video.
Sorry for them, right? So they don't get to experience it like we do. Yeah.
Right. So unlike us, we got a face for
we have a face for podcast. 100%.
That's right. 100%. Yeah. So there was an interesting article on Vet Candy recently, and it says that exercise will make you smarter.
Hold on. There's a bunch of interesting articles on Vet Candy.
This one says
don't
exercise.
Act like that's a surprise.
Exercise will make you smarter. Did you see that one?
I didn't see that one.
You know who probably saw it?
Who? Our guest.
Our guest.
Of course.
Yeah.
Yeah.
I think so.
Yep. So
that's how he's smart.
Because he exercises a lot.
Dude.
6 times a day.
I'm telling you.
I heard.
It's happening.
It's a rumor.
Anyway, but we won't make any more fun of him because he is one of our friends. He is in the Vet Candy family. Into the Candyverse today comes Dr. Courtney Campbell.
Whoa. That's a very generous introduction. Lots of backhanded compliments included. I was really entertained by that. I think one thing has been established throughout the years in that I definitely have a face for radio, but now it's elevated to podcast. So I'll graduate from
Courtney,
radio
that's
to podcast.
Not what we're saying. We're saying
Thank
you have a face
so much
for TV,
for
allowing
me to be on your show.
That's right. Hey, so we do that only because you're part of the Vet Candy family, and listeners know, right? The news hounds, you guys are aware. You know what's up. Okay, so let's get into the topic because Dr. Campbell, CBD. It's a big deal, right?
It's a huge deal. I mean, at least in a lot of worlds within veterinary medicine, whether you are in the surgical world, internal medicine, neurology, behavior, general practice, wherever you are within the veterinary medical space, I've noticed that the knowledge base for CBD is steadily increasing. And it's important because I find that a lot of people are interested in what's the next phase. Is there true science? Is there true efficacy behind CBD? So as the interest is growing among pet parents and owners, I think veterinarians need to, or I think it's important that veterinarians increase their knowledge base when it comes to CBD as well.
Yeah, well, that's what's interesting.
Well, I like to increase my knowledge base in general because, it's not very big, but I'm trying to get it. This is why we like to bring people like Dr. Campbell on to increase my knowledge base,
that's right.
Especially in CBD. But I've heard that there can be some confusing things about CBD. What does it treat? What does it do? All this other kind of stuff. So I don't even know.
Yeah, well, on top of what does it treat and is it efficacious and how do you give it and how dangerous might it be?
Dangerous.
Is it legal?
That's another question. I thought we were saving that one for a little bit later. That's a biggie.
That's a big one. Yeah. Well, we got to get to that first. But actually, I do think we'll get to safety and efficacy right off the bat. So, like right there, shall we just get the elephant like in the room discussed? Dr. Campbell, what do you think?
Yeah, no, listen, we are at a true intersectional moment here where we're fusing both efficacy, science, and evidence-based medicine with legality. And we're wrestling with both components at the exact same time, which is a rare situation to be in. Usually, if a new drug comes out onto the market, it's been thoroughly researched, it's been shown to be efficacious, and in addition to that, it's legal to give. You know what I mean? If you come out with a new anti-parasitic agent to prevent fleas and ticks, rarely are we thinking about, I'd like to prevent my dog from catching some sort of infectious disease, but is it legal to do so? And so because we're wrestling with this and the popularity of these drugs are steadily increasing, I think this is important to talk about now more than ever. I would say this. Let me just be completely honest. 8 out of 10 patients I see, or 8 out of 10 clients, I should say, are interested in some level of either naturopathic, alternative, adjunctive treatment methods in addition to Western or pharmaceutical-based medicine. So I think that when I see clients, a lot of them are already giving CBD-based products or hemp-based products without either consent from a doctor or consulting with the doctor. So it's out there, it's here to stay, and I think it's important to talk about.
But in fairness, Dr. Campbell, we should alert everybody that you're practicing in California. And California,
I'm not sure what you're trying to say about California.
Yes, I think
but
you are very sure.
I'm saying, number one,
if I'm picking up what you're putting down, then I could be in Denver, Colorado. I could be in Washington, Massachusetts, New York, and the list goes on. So literally, this is sweeping the country without disparaging all Californians.
No, I wasn't disparaging California. In fact,
I'm kidding,
everyone knows that I'll take any beach. I don't care if it's in California, Florida, Texas, it doesn't matter. However, my point was that California is actually even considered legislation at the state level to allow for veterinarians to prescribe, etc., medical marijuana for pets, which is on the leading edge of the regulatory issue for marijuana, CBD, and all of that. That's very much California's in front of that. And so it would stand to reason that citizens in California who have pets who are uncomfortable or might benefit from some use of CBD would be more aware.
They have pets?
They have pets.
Yeah, okay.
Oh, yeah.
Because that's going to happen. I get some medical marijuana for my pet dog, right? That's it does happen.
But I'm saying, but you are correct. You could be in Colorado, you could be in Washington, you could be in a lot of states that are looking at the state level to legalize more than just hemp-based products as the federal government has done recently. So that was the only thing I meant by California, because practicing here in Florida, it's a very different situation. However, clients still come in every day. Every day. There's more than one client will come in and ask quietly, maybe a little furtively, about CBD use in pets. And so what we want to determine or discuss with you as an expert is it efficacious? How much do you give? Is it safe? How do you do it? What are you going to use it for? What are the indications? Because it doesn't cure everything. You can't cure, it's not snake oil, right?
Well, I don't know. According to some people, it cures everything under the sun. Yeah. It's fantastic. And then some people say it's not effective at all. So it's the same kind of problem we have with anything that's new. So
Right. So, all right. So what, which of those should we tackle first, Dr. Campbell?
Well, let's see. I think it's important. I think literally everything you both just said is so critical and so important, because part of what I'm concerned about is that there's a really loose definition of glossary terms surrounding this topic. I'm also concerned with the fact that the efficacy of the the drug or the efficacy of the chemical is going to be contingent upon is basically on integrity and quality assurance. So, if you look at a product like a hemp-based product, you'll find people who are giving that product. And like Jason said, they'll say, hey, I don't think this works. But if you look at like recent studies, they've found that commercial hemp products, only 23% of hemp oil extracts actually met the levels of what they said was in the product. And some of them didn't even make label claims to that point. So my concern really is there will be some people who are giving a product that is not what it says, not what it's purported to have in it. And they'll simply say, this is junk science. This doesn't work. And therefore, they'll leave with the conclusion that these products have literally no benefit and we shouldn't give them, when the unfortunate side is they were just giving an inferior product. So let's start with, what is hemp, right? What is industrial hemp? And my understanding of it, and the reason why I always preface it with my understanding is because we are growing in our knowledge literally every week about this. Everyone is really trying in earnest to increase their knowledge base. So I definitely always provide the caveat that it's a continuing process. But to my current understanding, industrial hemp is basically the legal term for cannabis sativa product that contains less than 3% THC. And marijuana is a strain of cannabis that contains more than 3% of THC. Is that your understanding, both of you?
But I think that perhaps we had a hiccup in sound, because did you mean to say 0.3%?
Yeah, 0.3%.
Yeah, and we heard 3%.
We did.
There's a big difference.
Yeah, that's huge.
That was good,
Yeah, so 0.3%. That's correct. The federal government defines commercial hemp or industrial hemp, which is the legalized product that from the 2018 Farm Bill, as containing less than 0.3% of THC, which is the agent that gets you high, right? That's not the CBD people are looking for, right? These aren't the droids that you're looking for.
Right.
That's THC, the stuff that gets you high. So the CBD content isn't addressed, right? When we talk about the definition of what is hemp.
It isn't. And a lot of people want to know. So we've got that 0.3% differentiation between what is hemp and what is basically defined as marijuana. So big deal. What does that do to the body? Why do we even give it? And it really just boils down to that endocannabinoid system. And my understanding of the endocannabinoid system in its most overarching and simplistic terms is just about homeostasis, just about getting your body back to normal. And there are receptors obviously found throughout the body. That's why they call it endocannabinoid, because it's comes from within. But you can find receptors all throughout the body. The specific ones that people really reference are the CB1 and CB2 receptors. The challenge is that when you start talking about it, my concern is that when we try to put it into these two camps, basically CB1 or CB2 or endocannabinoid, it's way more complex than that. And I feel that the way it works in the body sometimes can be distilled into this level in which it's this or that. And I think we sort of undervalue or understate the complexity regarding how it actually operates in the body.
I'm pretty sure that's how Dr. Jason does it.
Yes, 100%. Does it work? Does it not? That's
understates the complexity of the
100%.
of the entire discussion. Absolutely. So we're going to take a quick break, but on the other side of this break, Dr. Campbell is going to talk with us about how do we know how much is effective? How do we know how much is dangerous? Is there any science out there, that evidence-based medicine that he mentioned at the beginning, at the outset, so that we can get into that? So hang with us through the break and we'll get right into that.
Come on, Charlie. Good boy. Here you go. Charlie's getting older, but he still moves like a pup. Developed by vets. Approved by pets. Hemp Hips are delicious, chewy treats that are packed with good stuff like vegetable-sourced glucosamine, chondroitin, omega-3 fatty acids, turmeric, and hemp oil, one of nature's superfoods. Regular use of Hemp Hip soft chews may support your dog's full range of motion, mobility, and quality of life. Love your puppy for life. Learn more by visiting vetnaturals.com.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We're animals. Deal with it. Pet Life Radio. Let's talk pets.
Okay. All right. Thanks for staying with us. Although I'm sure you stayed with us because you want to hear what is the science out there behind CBD use in your pets. Maybe you've already tried it in your dog. Maybe you've already given it to your cat. I don't know. Have you?
I have not. Clients can get it over the counter, right? Some CBD products. You don't have to go to the veterinarian to get it. So I bet you a lot of them have.
Yeah, let's not go back down the regulatory rabbit trail.
Oh, sorry. All right.
No, we're talking about science here.
Okay.
We're talking about evidence-based medicine and to see what's happening. Although regulatory is important because, like, as Dr. Campbell, as you mentioned, what's in the bag may not be what's written on the bag.
Exactly. It's tough. If I'm seeing, let's say, a dog, right, for osteoarthritis, and I'm really concerned. I say, oh man, we start from the beginning talking about some of the principles behind treating osteoarthritis. And of course, we talk about weight loss and regular exercise and anti-inflammatories and all of the rest. And they say, well, I'm also giving CBD. I'm like, oh, okay, well, fantastic. How is it working? I'm not sure. Where are you getting your CBD from, I might ask? Oh, I just got it from a local farmer's market.
Or the gas station.
The gas station.
Biggest impediments to this CBD is, like you were just saying, Jen, the lack of regulatory control, the legality behind it. Because it's the legality is still being figured out, then there's a whole array of different concentrations and ratios and qualities around what's happening. And so I strongly believe if you're looking to give these products, let's say you've done the research, which we'll talk about, sure, right? Let's say you've done the research and convinced it could be effective for your pet, certainly try to get your product from a bona fide institution, a bona fide company that's under sort of more rigorous vigilance in regards to their quality assurance. Would you say that, or would you just say, Jen or Jason, that anywhere should be fine and it's no big deal?
I would never say anywhere is fine, especially.
Oh, okay. All right. Sounds like we agree on that.
Yeah, especially, there's a shocker today, especially with a product that is in what we call, or some people call, like a regulatory gray area. And you know me, I don't like gray areas. I like it black and white, and I like the rules. And actually, the FDA has said that they do not regulate animal supplements. Right? Animal feed, yes. Animal drugs, yes. Animal supplements, no. And so there's no entity that's overseeing to make sure quality control exists, so that what you say is in the bag. And so the other thing, like Dr. Campbell, go ahead.
So CBD then is considered a supplement, or not. I mean, that's sort of a little bit. You just kind of alluded to that, but I just want to kind of hemp. Let's get the right hemp products.
Hemp extract
are considered a supplement rather than anything else.
Can be sold as an animal supplement, not seeking to mitigate, treat, or cure a disease. Right. However, it can support the function of the creature. So, here's the question: aren't there stuff that can be toxic in hemp? Right? Like.
Most definitely. And that's why I think some of these safety studies coming out are interesting, because they're under very tightly controlled situations. Take a look at example for a study that came out in the Frontiers or Veterinary Science Journal, even this year in February of 2020. What they basically did is they used a random placebo-controlled study utilizing research dogs, and they used 5 different substances that they gave dogs, okay? And the substances they gave dogs were a CBD predominant oil, a THC predominant oil, CBD THC predominant oil of a 1.5 to 1 ratio. They gave sunflower oil as a placebo. Then they gave medium chain triglyceride oil as a placebo as well. So 5 different dosages. They took that CBD concentration. Again, remember, there's studies indicating that 2 mg per kg may have some benefit. They took that that concentration all the way up to 62 mg per kg. Yeah. And they found that particular CBD, or that particular concentration, 62 mg per kg, which is much higher than the 2 mg per kg shown that could be effective, was as safe as the placebo control. Now, the adverse effects that they saw in this study were predominantly in those oils that contained THC, the THC predominant oil, or the CBD THC oil that was 1.5 to 1. And the adverse events were lethargy, getting cold like hypothermia, and some neurological symptoms.
But no deaths, no animals.
No deaths, and of course they took a look at blood counts, CBC, physical examinations, and they saw mild elevations in liver enzymes. But I think the point that you're making is really important. As these studies come out, which really are heartening for those CBD enthusiasts or cannabis-based medicine enthusiasts. Remember, all of these studies are done in a very tightly controlled, highly regulated situation. They know how much CBD is actually in the product. They know these dogs. They're obviously highly regulated and observed and studied by veterinarians. And so I think that that's super important to mention. People say, hey, this CBD stuff is really safe. We're seeing no toxicity. And I would say, absolutely. That's apparently what the studies are showing. But where are you getting your CBD from? What's actually in the product? And so I do think your point is very well taken. That some things can be toxic.
And I guess I was thinking about other non-target items in the product. So if there's heavy metals,
in the hemp,
in the hemp
extract.
In the hemp extract, like if it's not, if it's contaminated with other stuff that the plant may have taken up when it was produced. Right, like, so it's not the target, like, so there's maybe the CBD concentration is exactly on target for your 2 mg per kg dose, but if there's a whole bunch of arsenic or something in there, that's no good. That's why your point earlier about make sure that you know the company. Make sure that you're confident in what they're doing. Make sure they do some quality control on their producers, et cetera, I think is very, very well taken.
Well, people are saying, well, how exactly am I going to know if this CBD product is actually, what it says is on the label? Is that what it purports to be? And I would definitely ask the company to show you evidence of what their label claims, like anything else. Is what's in the product what you say? And if they have trouble producing that, or if the label makes no claims to that, that to me is a red flag. Perhaps a green flag, one that basically says, hey, this is a good thing. A green flag might be a company that is fairly large, that is under increased scrutiny over a company that might be out of your friend's basement, right? Something like that. And so these companies, and again, nothing against anybody's friends, certainly nothing disparaging about basements in general. But I think overall, it's important to look at companies that have increased scrutiny in regards to their products.
And so, like, Jason, don't you think the next question is, like, do you know when to use it? Like, do you know,
my next question is, that's all interesting, but what can we use it on? Like, what is it safe to use it on? What have you used it on? What have other people used it on? What's the majority of people finding effective? And, can we tell our clients to, hey, go get some, or here's some here, or what's happening here?
Yeah, what are the indications for CBD use?
Yeah, well, and that's why I think our trio right now is awesome to talk, and I feel so lucky and honored to join you guys because you have that expertise in regards to different species and that breadth of knowledge. Obviously, my life is surrounded by really cute dogs and cats, but you see so many different species, and I'm curious to know your experience and expertise regards to cannabis-based products in other species.
You're so blessed that you have no ugly dogs or cats hanging out with you, or what's happening?
You know what? It's just,
or are there no ugly dogs or cats? I don't know what you're trying to say.
It's mostly Frenchies, man, so they're all cute.
That's funny. That's great.
Everybody loves a Frenchie. Okay, so Dr. Jason.
Yeah.
Have you ever had a patient that took CBD?
Yes.
Or hemp extract?
Yes.
You did?
Hemp extract. I've had a bunch, actually, because I will tell you. So we had, and turns out that this is, I think, a fairly common use even in humans. I don't want to get into some stuff that I don't know too much about.
So first of all, what species was it?
It was a baboon.
It was a baboon.
Yeah, it was a baboon. So
a baboon. Now, this is where things get interesting. Okay, everybody in the Candyverse, turn up wherever you are. Okay, pull over if you're on your commute listening to this. We're about to talk about CBD use in baboons. All right, Dr. Jason,
so
please
I'm
go.
really glad you're not setting me up for this, Courtney. Great. So first, I want to clarify something. It was not a cute baboon because I'm not sure. It was.
I don't think that exists.
I don't know if that exists. Okay?
No.
But
okay.
He was a very engaging male.
I was going to say they could be fun.
Very engaging male.
But they are not cute.
Not cute.
But fun, smart, interesting.
Yep. Yeah. And run around and all kinds of facial expressions. Anyway, so this guy had epilepsy, as is not uncommon in this certain species of
it was idiopathic
epilepsy. And he kept having breakthrough seizures. We tried a bunch of stuff without getting into a bunch of brand name stuff. The typical medicines you try for
Everything that's labeled for use for epilepsy.
Everything is labeled for use.
Yeah.
And so we were able to control it. However, we were controlling it by essentially keeping this poor guy doped up. Like, he was just sort of out of it. And this guy was a very engaging baboon. He would want to see you and jump up and say hi.
Might he be called gregarious?
Very gregarious. And so we knew something was wrong because he was just, it wasn't right to just kind of watch him sit there, not having seizures.
Yeah,
great.
yeah.
However, he also wasn't having a great life. So then you start to have the whole quality of life discussion, which isn't very much fun. So I said, forget about this discussion. I heard about this stuff from my friends at Vet Candy. I'm going to try it, right?
Run to the gas station and get some gummies.
So I did not go to the gas station. I went to my local distributor. We got some, and lo and behold, Dr. Campbell, I didn't have any idea how much to give. And I said, you know what, we're going to try some. So we tried some. We gave 2 meals, right? 2 meals a day, right?
Now, do you remember what dose that was?
I can't remember. We dosed it at something like 2.5 or 3 mgs per kilogram or something like that. It's been a while.
Okay, that sounds good.
You are not going to believe this. It only took one. Now remember, at this time I had to kind of taper him off the other medicine. So at this time he was on kind of both. But immediately once we got him only on the hemp extract, the hemp extract, 2 things. Remember, even with the typical seizure medicine, he was having breakthrough seizures, especially at night. We'd come back in the morning and find out that he had a seizure because had injuries, right? These poor guys, we had to lock him up at night. So it's very sad. So as soon as he got only on the hemp extract, not a single breakthrough seizure, not one. Coupled with the fact that his behavior went back to almost normal, running around, beating up the girls like they normally do, showing them who's boss. It was a really...
Hey, maybe let's not lead with that as a characteristic of the baboon who's awesome. That he runs around
beating up anyone in there. But it doesn't matter. Right? He's a normal behavior for the baboon, and we were very ecstatic for that. This was it. This was at that dose. And we even cut the dose in half. No change.
Wow.
No seizures. Great behaviors. All back to normal.
Not the level of sedation you were seeing with the
zero sedation as far as we can tell, and zero
Interesting.
seizures. So, and that continues today. Has not changed, and so I'd like to say that CBD probably saved this animal's life.
Yeah.
Because we were running out of options, right?
Wow.
And so I do have that as an anecdotal story. Now I've tried. I've tried CBD
thanks,
on some
Jason.
other stuff now.
That was a really heartening story and a heartwarming story. Not to put you on the spot here, but prior to that experience with that baboon, did you find that CBD as a concept, as a drug, as we talked about, alluded to earlier, as a panacea, did you find that it all was just very dubious? Were you skeptical of it? And did this change your opinion? Or did you have a very favorable, optimistic opinion about CBD and hemp-based products prior to treatment of this baboon?
I see we're back to the normal flow of things where Dr. Campbell's asking us the questions, but I'll go with it. I think that's a great question.
Just one. And
I will tell you, guys, and everyone out in the Candyverse, I was extremely skeptical, but not in a bad way. I just didn't know anything about it, right? I wasn't pro, I wasn't con, I was just like, I don't know. But guess what my options were at that point were zero. So I tried it, and sometimes you just kind of get forced in the corner and you can try it, and it was just the right time, I don't think 5 years ago that option would have been there, but it's there now. And also you do some research and you find out that this stuff apparently works very well with some seizures, so in humans or whatever. So I tried it and it worked really well.
Isn't that the only labeled use in humans right now, Dr. Campbell, is for like significant epilepsy?
I'm only aware of Epidiolex, which is an anti-seizure, anticonvulsant medication, cannabis-based anticonvulsant medication. But certainly, you think about some of the more common anticonvulsants, whether it's phenobarbital, potassium bromide, zenanzamide, and you think about all of them. Yeah, that is kind of the quintessential battle. Is it to sedate them, or are they too sedate? And when you get into that too sedate, it's like, what else can we do? And you found a suitable alternative, which is really awesome. And
it was great for that species in that.
And so we know. So we know. Actually, we know because it is the only FDA-approved use for CBD oil. Is that Epidiolex, like you mentioned, for seizures in anyone like over the age? I think it's over the age of 2. I can't remember. 2 years old is a big deal. But are there any other clinical conditions for which we have evidence that it's effective?
Well, are there any other clinical conditions in which we have evidence that it's effective? I think that, number one, anecdotal evidence versus research evidence. And I think the anecdotal evidence is pretty bountiful. You'll run into clinicians, just like Jason just alluded, just like Jason told that touching anecdote about that baboon, where they find it's effective. And on the levels of evidence, personal experience and expert opinion is the lowest level of evidence, but it's still on the level, right? It shouldn't be sort of dismissed whole cloth. Mm-hmm. So I certainly will say that anecdotal evidence among experts like Dr. Jason is worthy of listening to. However, there's some recent research coming out of Baylor that looked at two things. They looked at, number one, on the cellular level, both in a murine model and in human cells, both in mouse and human cells, does the phytocannabinoid CBD decrease inflammatory markers in those cells? And they found that it did. And then they went on to do a second component of that study where they gave CBD based products. One was liposome encapsulated, one was not, or naked CBD product. Whoa. And then finally naked they CBD. Gave a placebo. Right, naked you got to be careful about naked CBD. That's a different type of podcast, obviously. Yeah.
That's but like what naked they did is
they gave those three substances, and the results from them showed that, according to this study, were very positive. That they showed a huge benefit in quality of life and just basically occupational activities, grabbing their toys, their alacrity to go outside and play and walk and just be, as Jason said, just fun-loving, back to their normal personalities. You know what I mean? And it's got to be horrible to have achy joints. And literally, I get older and I've got achy joints, so I understand what that's like.
I was going to say, are you blessed with no achy joints, Dr. Campbell?
And it just makes me, achy joints makes you grumpy. It gives you a different personality. So if we can get these dogs a higher quality of life without achy joints, a lot of people are going to say, I feel like I have my dog back. Yeah. You know what I mean? Because once that personality comes back, and that's what Dr. Jason was kind of saying, I feel like I have my baboon back. You know what I mean? Because he was back to just being a normal baboon, as you were saying, playing with the girls in the most, fun and violent ways and stuff. So I think ultimately it's
I'm so sorry, gentlemen. Can really, both of you guys, can we not giggle about that?
I was kidding. The little baboon humor, your little baboon humor. But so I think as far as researchers goes, Jenna, like you're saying, there's some good stuff out there. And what's great about it is we referenced the safety study. We've referenced an osteoarthritis study. We're referencing level 4 evidence of expert opinion. And the research continues. And there's more and more studies coming out every month. And perhaps even in 2021, we may see a huge glut of papers come out looking at research in dogs. So, and so far, this is really important to emphasize. So far, I haven't seen any studies that purport to see severe adverse effects from giving it, right? I don't know if you two have seen any thus far.
I've seen none. In fact, on another episode of In Other News, when we had a CBD researcher on, he indicated that, they haven't found that the hemp extract products produce any sort of fatal toxicity in dogs. Now, and I'll tell you that in all my emergency experience in emergency clinics, I never had a dog succumb to having eaten somebody's stash. They looked a little funny, and I don't recommend that, period. However, I think that we're going to, like you say, we're going to see lots of information coming out in the coming years. And I hope that the news hounds will have a little bit of a critical eye when looking at that research and look and see who did it, and not like their name, but how they're associated with any product or with any company, just with a critical eye. It doesn't discount the research that they did, but just eyes wide open when you look at research coming out. Look for that peer review process, look for a control group, etc. Because I think we're going to see a whole lot of it coming out.
Yeah, no doubt about that. And listen, I want to sort of highlight and double underline what you said too. I would never advocate giving any pets THC, but like you, I have never seen a fatality associated with it, except when it's combined with chocolate or other substances,
or butter,
xylitol, chocolate, those sorts of things.
Butter.
So I have seen fatalities associated with that, but obviously you can't attribute that to the THC. It was potentially more likely the other substance it was combined with.
Yeah, and there was a fatality, I guess, a couple of years ago with THC containing butter. The dog ate all of the butter, but it didn't have anything to do, apparently, with the chemicals in it. It had to do with the rancidity of the butter. So,
oh, good Lord.
Yeah, never a good plan to feed your dog giant sticks of butter. Just not like a good plan. Don't do that.
Was the THC in the butter?
It was in the butter.
Like he had some and then he ate the butter?
No, it was in the butter.
So I wonder
and the same thing.
That's some good morning toast, I guess.
Dr. Campbell is too polite to mention there was probably brownies that were chocolate that contained the THC that he saw, right? But not me. I'll tell you all my emergency stories. Because people come in with them and you know it. Because Dr. Campbell's worked relief, regular practice, emergency practice, referral as a surgeon, like all of it, the whole gamut.
Otherwise known as a journeyman.
I know.
No, I totally get it.
Yeah, we've already gone over the fact that we're doing this on a Sunday.
We have to have another podcast just to go over the rest of his
credentials. I know, it's a situation.
Very funny.
But we're very pleased to be here on a Sunday talking about this cutting edge topic. And so let's see. So we visited on the clinical indications that may be supported by the addition of a hemp extract product, ancillary therapy, if you will. We've talked about the regulatory things. We've talked about the safety. Is there anything else, Dr. Campbell, that you think that pet owners and veterinarians really need to be aware of in the conversation surrounding this kind of burgeoning new product?
Honestly, I hate to say it, but I feel like our feline friends always get honorable mention.
Aww.
You know what I mean? What they've been showing a lot is that, even with these same concentrations, same dosage levels of CBD, that cats reach lower serum concentrations and it takes them longer to get to a therapeutic window. So not only are we going to have, as you said, burgeoning information, burgeoning research, and growing body of knowledge in regards to CBD and its indications and its efficacy and its safety in dogs, but there's going to be a whole new glut of papers coming out in regards to cats and feline and how this phytocannabinoid behaves in cats. Again, I haven't seen any papers talking about any severe adverse effects, but cats, their job is to drool and vomit, and they do their jobs really well, right? So when you give them an oil, they shake their head and they act like they're hyper-salivating. It's the worst thing ever. So that also has to be worked out too. So I think, listen, there are, depending upon which resource you go to, our feline friends are the most common pet in the United States, right? There are more cats in the United States than dogs, again, depending upon the resource you read. So, maybe we should be putting an emphasis on them versus dogs. But at the end of the day, listen, I hope we do a round 2 specifically focused on regulatory information, Dr. Jen, because honestly, you are such a rich resource to this, and Dr. Jason, you too. So I hope when we come back, we can do a round 2 so that you guys can talk about it, because that is something that I will be hanging on every single word.
Wow.
Look at that.
Did you hear that?
Yeah.
On a Sunday.
Yeah.
We'll take that. We'll take that, Dr. Campbell. And I do like how you mentioned the cats, because as we had learned, and as you told us on a previous episode, cats are not small dogs.
There you go.
That's right.
Amen. It's Sunday, so we got to say amen.
That's right. I mean, in a second, he's going to call for a witness.
Yeah, I
okay.
know.
There you go.
So, and I will say that, my favorite kitties, the Himalayan, they're large.
Oh, my goodness, man. I'll see you one Himalayan and I'll raise you one Maine Coon. You know what I mean?
Maine Coon. Everybody knows you love the Maine Coon. But Himalayans are better because their nose is smashed.
There you go.
And they all have inflammatory issues as they get older, etc. And, so I'm hopeful that there will be some research come out for our feline friends too. Thanks for bringing that up, Dr. Campbell.
Listen, no problem. Like I said, I think at the end of the day, as veterinary healthcare providers, we just need to become more aware about CBD products as well as the laws and regulations. And I include myself in that. So I am a work in progress. I'm learning more. And like I said, I'm just so happy I got a chance to talk about it with you both today.
Yeah, us too. And I think you're right. I think the medicinal value will continue to be further illuminated. I think the regulatory issue will begin to resolve itself so that all 50 states maybe are aligned a little bit more significantly with that 2018 Farm Bill that the feds passed. And because I think Idaho and Mississippi maybe are the only 2 states where you still have an issue with over-the-counter hemp extract products for use. So, I mean, this has been an incredible conversation.
Yes, another extremely informative with lots of big words with Dr. Courtney Campbell.
With Dr. Courtney Campbell. I know, he expands my vocabulary every time, right?
I took notes on this one.
I know. So we're always so excited to have you in. And when you take time to come on In Other News, we really appreciate it because we know that you're busy. You're being pulled in 8 different directions these days because you are such a wealth of information and an incredible communicator, as it were, especially as it relates to pet health. Well,
that's nice of you to say. I appreciate that. It's a little overly generous, but I'll take it on a Sunday. Thank you so much.
Dr. Campbell, I am rarely accused of being overly generous. But I will say to everyone in the Candyverse, if you're concerned that you're going to hang up or you're going to stop this podcast and not have any other resources, you can go to myvetcandy.com/CBD and find some resources there from experts so that you don't have to hunt all through the interweb and try to judge what's real and what's not. Whether you're a pet owner, whether you're a veterinarian, whether you're a technician, we don't care who you are. As long as you're an animal lover, check out myvetcandy.com.
There's some really good stuff there.
/CBD.
Sure.
100%. And so I think that's all we can talk about today. What do you think, Jason?
No, I agree. Covered most of it.
I know. And we should call this the episode where Dr. Jason talks about his baboon. That's
okay. Great.
Yeah, this is officially the baboon episode for sure. There's nothing that can trump that. I will definitely say and I have checked out myvetcandy.com/CBD, and I hope everybody else does too.
Excellent. All right, so Newtowns, thanks for joining us on this episode, and we'll see you on the next episode of Vet Candy's In Other News.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.